Hi, everyone. Welcome back to Coping Together. I'm your host, Faith, with the Mental Health Association of Central Florida. It's always a pleasure to bring back a previous guest. Today, I'd like to welcome back Dr. David Cavalleri. How are you doing, Dr. Cavalleri?
I'm COVID free. That's the best answer I can give right now.
I think that's a pretty, that's a positive answer. Well,
Yeah,
actually, it's negative. Um,
right.
that I'm glad to hear that you're COVID free. I think, like you said, that's something that, it's a good thing for all of us to be, and it's something we can focus on is our health when we're doing okay.
Yep.
And that's actually, a good segue into our topic for today, because as much as health is important, one thing that we talk about here on Coping Together is, especially with COVID, the importance of mental health. And so today we're going to talk from the clinical perspective about the individuality of the presentation of mental health. So kind of what makes it such a unique thing to everyone. And so I'll start by asking you, and this is a very loaded question, but what causes mental health?
Well, mental health is something that coexists with physical health, and it's something that develops over time. Some theorists used to believe that we were born tabula rasa, which basically meant that we're a blank slate, but there are others that operate on the belief that there are some things that are genetically wired into us, and that based on how our lives unfold, certain things may or may not emerge over time. So for some people, there is the belief that nature is really the determining factor in our mental health. For others, it's nurture. I tend to believe that it's a combination of the two, and what we're exposed to, what we experience, as children, as teenagers, and as adults through adulthood really kind of determine what each individual's mental health is. And the other thing that I want to say about mental health is that it's a subjective experience. The field has really tried to quantify what it is to be mentally healthy or ill or sick or whatever. But for others, and I happen to be one of them, I subscribe to the belief that it's really hard to quantify what it is to be human and how it is that we operate under certain circumstances. We joked about COVID and that piece, but one of the things that definitely can influence mental health is stress. And we'll talk, I know we'll be talking a little bit more about that, but I just wanted to touch back on what you had just mentioned regarding that, because I wanted to make sure that we had that connection there. But it really is it's a combination of things, honestly. One of the jokes that it wasn't a joke really, but more of a comment to a mentor of mine was that after we're born, all bets are off. I really believe that. Some of us are born more privileged than others, but I think at the end of the day, all bets are generally off in terms of how our lives play out and how we navigate it.
That actually was a perfect segue into my next question. And I thank you for your elaboration on that first question, because I do agree with you. And we talk so much about a lot of the topics that we have on this show, they kind of run into each other, because I think that's a lot of what mental health really is. I mean, there's constantly these new connections formed, that we realize there's a relationship between, whether it's, if it's something that you're born with, and then something that you experience through stress or through your environment. And so that actually leads me to my next question, which is, what makes someone more likely to struggle with mental health problems than, say, the person you're standing next to or the average person?
Well, I think when it comes to how folks experience life and what makes an individual, quote unquote, more prone to living with depression or with anxiety, really stems from some of the things that we experience as children, depending on the kind of living situation that we had growing up, the type of relationships that we have when we're children, the kinds that we have with siblings, other family members, friends. Certainly, we could talk on and on about adverse childhood events, such as different forms of abuse that could certainly lead to a person experiencing difficulties later on in life, but then there are other things that can help a person even at an early stage of their life, as in being able to express yourself, learning how to express yourself in healthy ways. When you actually start to look at some of the research in terms of emotional health, boys, when they're born, are just as capable of girls, and I mean cis boys and cis girls, that they are just as capable of expressing a full range of emotions, but then cis boys tend to get socialized into believing that expressing yourself fully is considered to be a negative attribute. So for a lot of those individuals growing up, they learn to, because of the way that society has kind of constructed reality for them, that are taught that it's not okay to express certain things. And I think that kind of repression or suppression can really be problematic for a person later on down the road. Now we can talk about privilege. That certainly is a factor. Simply being born a certain skin color, being born with a certain set of genitalia, being born in a certain part of the world certainly can contribute to a person experiencing difficulties or experiencing highs in their lives later on. But again, I'll go back to all bets being off. Although I think there are certainly some things that people experience more so than others. If we look just at the United States of America, even though skin pigment accounts for about 1% of our DNA, it's amazing how many millions and millions of people have suffered as a result of that, understandably, because of the fact that they were born a different pigment than their peers. So I think there are a lot of things that get passed on through our environment. And I don't want to neglect genetics either, because there's some evidence that shows that genes do play some kind of a role. Although I also think that, for example, if you looked at something like depression or even something like schizophrenia, that if you were raised in a household where people were living or struggling with that, I think living in that environment teaches a person that this is kind of the way that it is. So I think that is as much of a factor as anything else when it comes to a person struggling with something, that if they kind of learn a behavior early on in life, it becomes normal for them. And when I mean normal, I mean it becomes typical. And I don't mean normal, abnormal in the way that the psychology field or the mental health field defines it, but in the ways that people try to make sense of their lives and try to create meaning. But I think the way that reality is constructed from a social point of view, in terms of socially constructed, the way that meaning is created, I think go a long way towards the way that we develop over time. And I think there are a lot of other things that are potentially toxic and problematic that can make it difficult for a person to make sense of the world. And I think for some people living with depression or anxiety or anything else, and of course now I'm using the terminology in the field, but for people who are living and having struggles or difficulties, are trying to find the best ways that they can to live and survive and make sense of their lives. So I think, I don't think that we're wired to be necessarily miserable or unhappy or sad. I think a lot of things need to happen before you get from one step to the other. And I also talk about trauma in some of the workshops I do with the Mental Health Association. And trauma certainly can be something that can create obstacles in a person's life. But as I talk about in those workshops, a person is capable of recovering and healing. So it's not impossible for a person who may have experienced a lot of terrible things in their lives to still lead satisfying and happy times in their lives. Not that they're not going to have setbacks from time to time, but that it is possible for a person to overcome and live live lives that they feel good about.
I think you said so much there and covered so much that I want to go into it so much more with you. That's the mental health nerd in me. But
You might lose a lot of viewers based on
I,
what I believe.
but I really, you make such a great point talking about, again, we were talking already about those connections, genes play a role, privilege plays a role. There's so many aspects to that. And one thing I want to ask you, you kind of touched on this, but so if someone has a genetic likelihood that they're going to have a disorder, or if someone, environmentally experiences something, or, it gets to the point where they do develop a disorder, it sounds like what you're saying is that, it's not an irreversible thing, or not necessarily irreversible, but you're not completely powerless. You do have the power to, even if it's a situation that you can't necessarily like change your diagnosis, you can learn to cope and live with it. And like you said, that's your normal. And I agree with you that everyone should have their own, in my opinion, their own personal version of normal, because your daily life and what you do and what you think and what you believe is normal to you, and mine is normal to me. And I think openness tends to be, the key factor in that, of being able to effectively communicate with other people. So that's me going off on a little bit of tangent. Sorry.
It's all good.
And so, but am I correct in that assumption that, it is something that you can learn to live with and cope with?
Yeah, if a person thinks of their life as a narrative or as a book, that there are going to be moments where they feel like they are writing their own narrative, and there are going to be other moments in their lives where they feel like someone's taken the pen or pencil or laptop or whatever and is authoring the story for them without their permission. But I believe that everyone has the ability at some point to reauthor their story, to be able to rework their narrative. I believe that until our last breath, that we still have every opportunity, or that we still have a chance to make something different. Doesn't mean it's easy, doesn't mean it happens overnight. I don't want to downplay the fact that for some people that might be watching this, that you're going to just wake up tomorrow and all of a sudden everything is going to be gone. It doesn't work like that. It takes time for some people to really unpack the things that have happened in their lives, the choices that they've made, choices that were forced upon them, the moments where they felt like that they weren't writing their life story. But it is possible for a person. I truly believe that a person is capable. And you mentioned that aspect of personal responsibility. And we do have an ability to take some responsibility for our lives, to be able to make some of those changes. And I also firmly believe that it's not something that really can be done alone. Not that we don't need time to reflect, that we don't need time to cry, that we don't need time to feel happy. But I think that when it comes to living a life that we feel good about, I think it's something that happens with others. And I think that's part of the struggle that people are experiencing right now, especially, is that a lot of people feel like they don't have that ability to connect with others. And even though we're doing this via Zoom, typically, Faith, you and I would be sitting in a room across from each other and having this conversation with other people in the room to feel that energy. So, we're doing the best that we can. And I think doing this is a prime example of that even though things aren't great, things aren't fantastic right now, that there still are opportunities for us to learn and grow, and to reauthor and still be an author in our own lives, and not feel like someone has taken that from us.
I really like the wording that you use there, especially about, to be our own author. And I agree with you. And that's not, I agree with you in that it's important to make sure to give recognition to, like you said, everyone has their own journey. Everyone has their own situation, their own process. So it's not like you said, you're going to wake up and feel better, or there's that expectation. It's more like, if you are struggling, like you said, even till your last breath, you have the ability to at least have some influence over your life. And I think that's one of the best parts about humanity, is that we do have that unique opportunity. My dog, she listens to me. She doesn't really get to determine much except maybe when she wants to go outside. But I get to decide when I want to do something. Obviously, sometimes I feel more motivated than others, and that's part of the thing with COVID is people feel kind of out of their element, and they feel really, people feel tired. They're not getting up to go to work, not getting up to go to school, or if they are, it's a different kind of environment. And so with all that being said, one thing I wanted to ask you as well is that we've established that everybody is pretty unique, in that, people struggle for different reasons. Some people are more likely necessarily to have like a genetic predisposition, environmentally, whatever it is. Is there one universal way that like certain mental health illnesses present? I've heard a lot of things. I know there's a lot of beliefs that, for example, everyone who has depression cries. Is that true?
I don't know that I would say that every person who is living with depression cries, but what I would say is that they are experiencing pain. I think that would be the universal thing. For someone who is not feeling good about things, they are experiencing pain. And I think that's something universal that we all share, that all of us at some point in our lives have experienced something painful. And I think the same thing is true for people who've experienced something joyful. I think there are some basic things that we all do experience, that we experience highs, we experience lows. How they present or how it looks to other people may be completely individualistic. For some people, when they're feeling really sad, may sleep a lot more, or they may not sleep as much because they're thinking about things or feeling certain things, or they may be eating more or eating less, or drinking more or drinking less, or maybe engaging in riskier behaviors when they aren't feeling good. But I think really the universal thing, Faith, if we're getting back to that, is really that everyone feels pain, and that everyone feels joy. How it looks, though, I mean, all bets are off, really. I know, and it goes back again, what I said a little bit earlier about the way that some people are raised, that some people are taught that showing certain emotions are unhealthy, and that some people really feel as though they've been kind of wrapped up in chains to an extent, and that they can't be themselves, that they can't be their full selves, that they can't be their happy selves, their sad selves, their in-between selves, to be everything in between. But I think what every person experiences are pain, joy, sadness, relief, and I mean, some of those other really core basic emotions. I think everyone experiences those. I think part of the struggle for some folks is deciphering what it is exactly, and knowing that, oh wait, I'm in pain right now, and that's why I keep eating, or I'm in pain right now, that's why I can't get to sleep at night, or I'm really happy and I can't sleep because I'm so excited about what's going on in my life. So I think we all show it differently, but I think there are certain things at our core that we all experience. And I think another is that we all want to feel loved. I think everyone wants to feel loved. And I think that too is also different. Everyone experiences it differently. How we show love, how we receive love, I think those are also universal things as well. And I think when we don't feel loved, when we don't feel good, I think that's when we start to feel some of the other things that can create obstacles in our lives that can make things difficult.
Yes, I definitely agree with you. And I think that, one of the things that you touched on was, like you said, all of us, we feel pain, we feel joy. I think it's really great that you presented, both sides of that coin, that yes, we all feel pain. We also do feel joy. We all have moments that to us just like can bring a smile to us at the sheer memory of things. And so what I want to ask you is, from the clinical perspective, how do you know if what someone is experiencing or feeling is, I don't want to say natural, but expected given the circumstances, kind of like with COVID? And how do you know if or when that person might, it might warrant a diagnosis, or at the very least, it might be a good idea for that person to talk to someone? How do we find that line?
Right. Boy, things are really topsy-turvy right now with COVID. So I think there are a lot of people who understandably are feeling really down about things, feeling really isolated from others. I think that deep down inside we're social animals, and that not that we don't need time alone, because there are some of us that need time to recharge. But I think the moment when it goes, at least if we're going to talk from a clinical standpoint, to where a person is feeling a certain way or thinking a certain way, that if it really starts to interfere with them being able to get out of bed, not being able to do basic things like brush your teeth, take a shower, maybe not every day, because I mean, for a lot of us, we're not getting out of the house. But to regularly be bathing, doing basic hygiene, is usually an indication that a person is feeling something or experiencing something. Eating is another thing too. When a person stops eating, if a person stops working, if they're employed right now, and for those of you that aren't employed that are watching, remember that this is a moment, and that hopefully this moment passes for you sooner rather than later, and that things start to improve. But I think when it goes from a person trying to just kind of get through something and really struggling, I think a person starts to not pay attention to some of the little things, like taking a shower, brushing your teeth, making your bed. I know making your bed seems like a silly thing, and I know some people don't really like to make their bed. That's their thing. But when it becomes something of clinical interest to someone is when you start to notice some basic hygiene. You start to ask them about, what have you been doing lately? And they start to lose interest, or they state that they've lost interest for a period of time. And I think with COVID, things are really kind of murky right now, because a lot of people are feeling lots of different things. But if we were talking outside of COVID, outside of a pandemic, if you start to notice that a person has lost interest in things that they generally enjoy doing, if they're not maintaining contact with other folks, if they're isolating intentionally and are not really kind of responding, if you notice a change in a person's demeanor, and it's one thing if a person has a bad day or two, but if a person has been experiencing something, let's say for a couple of months, and when we talk about post-traumatic stress disorder, for example, just to throw one of the disorders out there, is that a person experiences something for at least 30 days. So if we're looking at it from a clinical standpoint, you're looking at least a month or two of a person really seeing a change in their demeanor and their attitude and their behavior and the way they talk about themselves. That's another thing too to pay attention to. If a person who may generally be upbeat or pretty even-keeled has really gotten to a point where day in and day out they're beating themselves up, and when they're confiding with people that are close to them, they're talking on and on about just how pointless everything is, how futile everything is. So it's like I said, it's murky right now, because there are a lot of people who are feeling more isolated. They feel like they're under house arrest. I understand why some people are getting frustrated with the masks and wanting to go out, because I mean, after 6 months of basically being inside, and we live in Florida, so it's hot all the time, but I mean, people like to get out. So it's understandable, even if it's coming at a price later on down the road with folks getting infected or getting sick. But I kind of went off on a tangent there. But really, when it comes to the clinical aspects, you're really looking for noticeable changes in behavior, hygiene. Look, I see a therapist from time to time, and one of the things that she tells me she notices is that if I haven't shaved in a week or so, if I'm looking very salt and peppery, she'll say, what's going on? Because I don't mind letting my facial hair grow out a little bit here and there, but generally speaking, I don't let it grow out too much. And and it's true just from the training that I've received, that when you start to see noticeable changes in a person's appearance, behavior, and the way they talk about themselves, the way they talk about the way they feel about themselves, and if it's been going on for an extended period of time, that's when it might be a good time to say, hey, is everything okay? Is there anything I can do? Tell me what's going on. And a lot of times, really the best thing, even if you're not a clinician, is to just ask a person, tell me what's going on. I'm here to listen. Because a lot of times a person who is not really in the best place and is brave enough and vulnerable enough to share with another person is really just looking to be heard and validated. Not necessarily to be told, oh, well, you need to do X, Y, and Z to make everything better. A lot of times being able to express yourself and feel validated can really help a person start to make some small steps in feeling better about themselves.
And it sounds like, from what I've heard you say, like you said, definitely from the, the clinician who observes that, and I think your therapist sounds awesome because she is that observant. But also, like you said, I think a lot of it comes down to the people that we see on a daily basis who notice those changes in us. So whether it's our partner, it's our family, it's our kids, it's our friends, whoever it may be, it sounds like people are actually for the people who care about us, our close people are pretty observant, and they know us where they might be able to start to tell if we're not okay. And if we know someone who's going through that, we basically just say to them that reminder of, I'm here for you. Do you want to talk? Do you want to tell me what's going on? And just trying to check in with that person so that they don't feel alone, and making sure they do feel validated. Is that correct?
Yeah, if a person is willing to open up, I think the most important thing that they're seeking is some kind of sense of validation, that they're being heard, that they've been listened to, that they, and in other instances, that they don't feel like they're alone. Because there are a lot of times when a person, if they are really struggling with something, will tell themselves, I'm the only one feeling this. No one else knows what it's like to feel this. And sometimes when a person opens up to someone and the other person says, oh, I'm really sorry you've gone through that, and you're listening to them, and maybe you share a little bit, and that person says, oh, okay, I don't feel quite the same because I know other people who've been through that. And that's part of why we do some of the support groups that we do at the Mental Health Association, because there are people that feel like they're the only ones living through something. And it's not meant to demean what they're experiencing at all. It's to let them know that, hey, you're not alone. There are other folks out there struggling. It's okay for you to be struggling. It's okay for today to be a crappy day. Maybe tomorrow will be a better day, or maybe tomorrow will be another crappy day, and that's okay. But know that there are other folks who are here to listen, to be there for you, to be supportive of you. And it doesn't matter if it's a support group, it's a friend, it's a partner, whomever, family member, whoever it is that you open up to. But that is really important for folks. Folks want to be heard. People want to be loved. Everyone wants to feel love. And I think feeling validated is another way that people feel love.
Thank you so much for sharing all that. Especially, I agree with you about that feeling of love and validation. And I know so many of us want to help our loved ones when they're struggling. And that's a big part of why, we do coping together, because we all want to learn, how can I be there for my loved one? And also, how do we take care of ourselves? And so thank you so much for being here, David. I think that's a great point to close on. Was there anything else you wanted our audience to know, though?
Really, just if you're going through something, if you're experiencing something, it's okay. It's completely okay. You're still a wonderful human being. You deserve love. You deserve to be heard. You deserve to be a part of this mess that we call the human race. that you matter, that you're important, and that if today isn't a good day, that's okay. And if today is a good day, that's awesome. And let people know that you're having a good day.
Yeah.
There's nothing wrong with sharing that too. Sometimes I think people forget to say, hey, I had a really good day today. So it's important to focus on that too. I think sometimes in the clinical field and the professions, there's a huge focus on some of the negative aspects. And I know there's positive psychology and constructivist psychology and humanistic psychology and feminist psychology that attempt to try to pivot the way that we look at things, but it's easy for folks to get down on themselves. So if you're having a good day, enjoy that, take that in, celebrate it. It's okay to have a good day too, as much as it is to have a lousy day.
That was really well said, actually. And thank you so much, for everything, for being here again. It's always a pleasure to have you on the show. To all of you watching, thank you so much, for being here, watching us. I always say it, but you're the reason that, we get to do this show. I get to be here to talk to you. If you have any questions, comments about anything related to this video, or you have any ideas of topics you want to see in the future, please reach out to us at the Mental Health Association. Like David said, we have, many support groups, many programs that can help get you connected with, different resources. We all just want you to know that it's okay to get help, and it's okay to not be okay. So with that, thank you so much for watching. Thank you again, David, and I will see you next time.
Yes. All right.
Thank you.